Yeah, shortness of breath. It depends on each individual kind of experiences it differently. With severe shortness of breath, it's very noticeable when you're at rest. You can notice that you're breathing a lot faster. You might have to use more muscles to kind of take a deep breath, and you just don't feel like you can get a full breath. In other scenarios, it might be, you're walking somewhere where you normally walk, and all of a sudden you're finding I'm really out of breath. So that's another way to kind of keep an eye on how you're breathing. And in the emergency room, it's a combination of anywhere from, they really can't catch their breath and they're breathing very shallow to, it just doesn't seem quite right. I just feel like I can't quite catch my breath. So it really depends.
So it's interesting with COVID patients, as opposed to many other patients who present with respiratory distress, they are alert and awake and still able to talk. They're breathing heavily, but their oxygen saturation, which is a percentage from 0 to 100%, though I have to say I've never seen a 0 in a live patient, but most people are around 97 to 100% oxygen saturation, so the level of oxygen in their blood. And we get concerned usually when people are under 90, that's considered more serious. We put oxygen on. And many of these patients are coming in still alert and awake and talking, but with saturations in the 50s or the 60s, which is something in my experience in emergency medicine and in other critical care medicine, I haven't actually seen. Most people are not at that stage alert and awake and talking. They're very sleepy, very drowsy, and it's a very different situation that we're all facing. And this has been reported in other centers as well, and coming up on a lot of the emergency medicine blogs and case for studies and that kind of thing. So I've had a few patients who have come in with SATs like that. And what we do is we put them on a full oxygen mask, but we have to be very careful because at higher volumes of oxygen, there is the chance that people will aerosolize, so that droplets will become fine droplets with virus in them and then get out into the air. So we have to be very careful and change our PPE so that we're wearing the more advanced sort of PPE in that situation. And with these patients, what we're seeing is that their oxygen saturation will go up a bit, but it won't come back to normal, even with these really high volumes of oxygen. And then we move to the decision to intubate, which is when we give patients medication to make them sleepy and unaware of what's going on. And we insert a breathing tube into their lungs and then have a machine breathe for them. And it allows for people to have their lungs rested a bit and to make sure that we're giving as much oxygen as possible and to change the pressure at which we're giving oxygen to allow more efficient spread of oxygen into the bloodstream. And so we go through a consenting process with the patient. If in these situations we're talking to the patients directly, usually we're talking to family members by that stage, but we're talking to the patient, letting them know what the pros and cons are and what they're going to go through. And then usually I try to, at the very last minute before I give them sedating meds, reassure them that they're in good hands and that we'll see them soon and that we're going to take good care of them. It has to be frightening. And it's a situation where they're just seeing me and my mask and my kit and not their family members. And so we try as much as possible to make that human connection at that moment as well. We have a team of people around that do that. And we give medication and then we insert the breathing tube. Now, with these patients, we're finding that at the moment we give them the medication, their oxygen saturation levels drop rapidly, very rapidly, more than what we are usually seeing. So it really does take a very skilled person to be able to do this appropriately. And so we've worked on strategies around that at UHN to make sure that we're giving the best care to these patients.